Are we ready? Everyone ready? Okay. Well, good afternoon. Tim Richmond with Wapello County Emergency Management. As you're all aware, there is an expanding global pandemic of respiratory illness called COVID-19 caused by a novel coronavirus. A community spread of COVID-19 is being detected in Iowa, and the symptoms of COVID-19 include fever, cough, and difficulty breathing. As of today, we have a confirmed case of COVID-19 in Wapello County. Wapello County Emergency Management is working closely with the Iowa Department of Public Health, our local county public health, and nursing and healthcare partners to respond and mitigate the spread of the COVID-19. The Wapello County Emergency Operations Center is operational, and every member of our local government, healthcare system, and emergency management team are focused in the efforts on the COVID-19 response. Ongoing meetings to address Wapello County's response to COVID-19 are being held via Zoom by emergency management, city county officials, Wapello County Department of Public Health, and our healthcare teams. Request for PPE resources to support the efforts of our healthcare providers and first responders has been submitted to the state for review and procurement. We are calling on all citizens of Wapello County to do their part in reducing the spread of COVID-19 by practicing social distancing, staying away from gatherings of people, and limiting non-essential travel. If you are sick, particularly with symptoms of fever, cough, and difficulty breathing, please call your primary healthcare provider before going to the hospital or office. Even if you don't have a primary healthcare provider, feel free to call any one of our local clinics. Continue to wash your hands, stay home when you're sick, cover coughs and sneezes, and sanitize all hard surfaces. Wapello County Emergency Management wants to ensure the Wapello County community that we are aggressively responding to protect the health and safety of Wapello County residents and provide our essential service providers with resources needed to stop the spread of this COVID-19. We strongly encourage our community to follow the recommendations of local public health and healthcare providers in order to protect the residents of our county. And I will now turn it over to Linnell Deers, the Director of Wapello County Public Health.
Thank you, Tim. Today, March 23rd, 2020, Wapello County Public Health was notified of the first laboratory diagnosis case of COVID-19. The person is receiving appropriate medical treatment and is working with Wapello County Public Health. Although evidence of community spread was occurring in Iowa last week, this is Wapello County's first laboratory diagnosed case. Right now, our focus should be on the health and well-being of all residents of Wapello County. And we must work collectively and collaboratively, work together to stop the spread of the disease. The best way to prevent illness is to avoid being exposed to this virus. There is currently no vaccine for COVID-19, which means other prevention measures must be followed to stop the spread of this virus. Everyone can get sick from this virus, and some populations are at a higher risk for serious complications. These populations are older adults and people with underlying health conditions. We as a community must do everything we can to prevent the virus from spreading in our community. As we have said many times before, it is especially important to remember the importance of the 3 C's. I cannot emphasize this enough. These are things everyone should do for your own health and the health of your loved ones and the health of your community. Cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow immediately. Wash your hands after that. Clean your hands often by washing with soap and warm water for at least 20 seconds, especially after you have been in a public place or after coughing, sneezing, or blowing your nose. If soap and water are not available, use a hand sanitizer with at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. Contain your germs by staying home if you're sick. If you need to see a healthcare provider, call first. As with any other illness, if symptoms are severe, call 911. Symptoms of COVID-19 include fever, cough, and shortness of breath. Practice social distancing. Please stay home when you can. If you must go out, put distance between yourself and other people, no matter whether they appear ill or not. A general rule is to stay at least 6 feet away from other people. Avoid social gatherings in groups of more than 10 people. Following these recommendations will limit your exposure and will slow the spread of the virus. This will prevent a sudden increase in sick people that would potentially exceed the healthcare system capacity to treat patients with or without COVID-19. Most mildly ill Iowans do not need to go to their healthcare provider or be tested to confirm they have COVID-19. Those mildly ill Iowans are able to recover at home. We are asking all sick Iowans to stay home and isolate themselves from others in their house. Stay home and isolate from others in your house until you have had no fever for at least 72 hours. That is 3 full days of no fever without the use of medicine that reduce fevers. And other symptoms have improved. For example, when you cough or shortness of breath are better. And at least 7 days have passed since your symptoms first appeared. If you think you may need health care, call first. Your provider can assess whether you need to be seen in the office or if you can recover at home. Isolation recommendations for well Iowans with potential COVID-19 exposure. Iowans should stay home and isolate themselves from other people in the home in the following situations. Isolation should be in place for 14 days after the last exposure. If you've traveled outside of Iowa for business or vacation in the last 14 days, and that means the isolation starts the day you return to Iowa. That is day 1. If you've taken a cruise anywhere in the world in the last 14 days, and I will repeat again, your isolation starts the day you return to Iowa. That is day 1. If you've traveled internationally to a country with a level 3 travel warning in the last 14 days, or if you live with someone who has symptoms of COVID-19 or has tested positive for COVID-19. Self-isolation means you stay home and you do not go to public areas or attend gatherings. You distance yourself from family members and household pets and livestock. Do not use public transportation or ride sharing. Postpone all travel. Wash your hands often and practice good hygiene. Postpone all non-essential medical appointments until you have completed your 14 days of self-isolation. If you have an essential medical appointment during this time, please work with your healthcare provider and local public health professionals as needed to help coordinate the visit. What should I be watching for during self-isolation? Take your temperature twice a day. Watch for a fever. Watch for a cough or difficulty breathing. We are asking this community to come together in support of one another. It is vitally important for the Wapello County citizens to follow these recommendations to protect our most vulnerable and frail citizens. We know that many of our community members will be anxious after hearing this news, and I want you to know that Wapello County officials and healthcare leaders are here for you. We have spent many hours preparing for our response to COVID-19. Our goal is to protect the health and well-being of the community. We are working aggressively to implement mitigation strategies and a robust emergency response plan for epidemic illness that has been practiced for many years. We ask that you do your part to help protect our communities and families. If you have general questions about COVID-19, please direct them to Iowa 211 or go to www.idph.org. For local questions, follow Wapello County Public Health on Facebook or call Wapello County Public Health. Thank you very much.
And with that, are there any questions from the media?
In regards to travel, not just international, but if you're traveling from state to state, is there concern as well?
The question was, in regards to travel internationally or just traveling state to state, is there a concern? Yes, there is a concern if anyone has traveled outside of Iowa that when they return, they isolate themselves for 14 days. What is excluded is the people that live on the borders of Iowa and they may have a job that they have right across the border, Omaha, Council Bluffs, Rock Island, Davenport. They do not need to isolate themselves when they're going back and forth to their job.
You said there was a case confirmed in Wapello County. Can you say where in Wapello County it was confirmed?
The question was that is in the response of, we have a confirmed case in Wapello County. Can we identify where in Wapello County that this case is? And no, I am not at liberty to identify where in Wapello County this case is.
Was this well, do you know if this was a case of community spread or if it was someone that was traveling?
Okay. Question was, is this a case of community spread or travel? Right now, Wapello County Public Health is actively following the case. So we're trying to get the information right now as I speak to be able to identify, was it community spread or was it travel related?
Does this case, I'm sure you obviously already have plans in place, does this quite change the timeline that you guys are on for any precautions you were going to take?
I can take that question. So the question was, does it change any timelines or any of our strategies? It does not. We're staying with our core message that you've heard several times with the isolation, social distancing, practicing good hygiene. All those messages remain the same. I think the case just illustrates how much more important it is now more than ever so that we can prevent that spread throughout our community. It's inconvenient. There are sacrifices that have to be made. We recognize that. But remember why we're doing it. As it's been discussed from the CDC and IDPH, 80% of people will experience mild symptoms, but 20% will not. They're our high-risk group. That's who we're doing it for. So we need to protect those valued people in our community.
How quick was the turnaround with the positive test? How long did it take for that to come back?
The question was, how quick was it for the turnaround of the test? I am going to defer that question to later because right now in our investigation, we are getting all that information. So I'm really not at liberty to say it was 24 hours or it was 48 hours, and I don't want to give misinformation to you.
Can you say how many tests there have been conducted on people in Wapello County?
The question was, how many tests have been done on people in Wapello County? Iowa Department of Public Health just recently signed an order that all positive and negatives will be reported back to the county through our surveillance system. And when I checked our surveillance system yesterday, there was no negatives being recorded in Wapello County as of that time.
Any other questions? With that, I will just tell everyone, media included, that we plan on continuing our Thursday talking points at 6 o'clock here with the pertinent partners of the issues of that week. This evolves, as Jerry has said in a previous address, and not just day by day, but hour by hour. It literally changes that fast. But we will make a commitment to you to be here in this forum every Thursday at 6 o'clock to answer questions and update you on the activities of the preparedness and response by everyone in the community.
You know, one thing I think we'd like to assure you of is, as soon as we found out about this case and it was verified that it was true and not a rumor, and we tried to gather some information, as soon as we got it, we called you. The question was about the governor was going to give a talk at 2:30, and it had been suggested to us that maybe we not announce this here locally until after the governor did, but they gave us some leeway on that. And as you can see, we didn't wait. We want to assure the public and assure the media that if we know it, you're going to know it. There's nothing to hide, and the worst thing that can happen to us is if there are rumors out there. Those rumors can just devastate the process. So be assured, you know, we could have waited till tomorrow and Linnell might have had some more information for you. But I think we as a group have decided if we know it, we want you to know it, because you are our best avenue to the public.
Mayor, any closing comments?
Just want to say thank you to all of the public health professionals and our public safety professionals who are working daily with this challenging virus. And let's support them and let's be very helpful to them. So helping them is taking good care of yourself and following the governor's recommendations and the CDC and the Department of Health. So everybody can have a part in this and help get the community through it. So thank you for what you all do.
We'll see you back here Thursday if we don't have an update before then.